All right, let's see what it looks like to palpate somebody. So we'll start with some Mopal on her. Why don't we start with the neck since we're sitting here. So fingertips, posterior aspects of her articular pillars. Press forward and drive her into extension. Rotation into a direction of rotation. So right now she's in left rotation. I'm on the posterior aspect of her right articular pillars. With my thumb pad, ooh, that's a good one there. Find places that I'm going to want to adjust. Okay, so in right rotation on the left articular pillars. How's that feel right there?
Tender.
Yeah. Okay, lateral bend. So now I'm going to go on the lateral aspect of articular pillars. So if I'm on the back side here, lateral is way out here. So I do two fingers, my thumb and my middle finger, and I'll grab both sides of the articular pillar, and I'll pull on one, push on the other to go left and right. So right now we're going to pull with that middle finger as I push the head up and over. I'm not trying to push down and over and compress her facets. That doesn't feel great. So up and over is your, I guess this would be considered an indifferent hand motion. Okay. Now for the thoracic and lumbar spine, we'll start with extension. Do a little I Dream of Jeannie, so arms out front like so. Okay, the closer I am to her, the easier this is on me. So I get a stance where I'm quite close to the side of her arm. My arm goes underneath, and she leans forward, so her weight's in my arm. I take, sometimes I vacillate between these two fingers here while I'll kind of do that, where my thumb is on one transverse process and the side of my index finger's on the other. When I get low, sometimes I use the thenar, sometimes I'll hit the space between the thenar and my hypothenar, whatever works for you and whatever feels the best as far as the sensory input you're getting out of the palpation. So we start at the top. I'm going to hit each vertebra as I go. One thing you want to keep note of is that you're pushing straight. You're not trying to extend and rotate them during this palpation. So make sure your stance is good, because if you're too far away and they're turned already and you're doing this, you're kind of rotating them, you'll feel restrictions because you're asymmetrically pressuring the joint. So you want a symmetrical extension with that. Now for rotation, you can hug your shoulders, so grab, there you go. You can come across and grab a shoulder. You can put me at a table, come in on the side of the spinous process. So if I'm going to rotate her to the right, I'm going to hit the right side of the spinous process. And as I pressure her into rotation with this hand, I'm pushing on the individual vertebra with my opposite hand. And I use the front end of my middle finger, just because it's my strong finger. If you feel like staying on the same side of the table, you can then just pull instead of push. If you're going to do that, hand can come around like that. And as I rotate her, I can grab the left side of the spinous process and pull. I don't actually prefer this move, so I would walk across the other side of the table and do it just as before. Notice I'm not flexing her, I'm not extending her, not pushing her in lateral bends. She's sitting up, upright, and I'm on axis rotating her to evaluate rotation. For lateral bend, make this a little tighter. You can press down on one of the shoulders and induce a lateral bend. Again, pushing in lateral to medial on the spinous process. With each push on the shoulder, push in with the thumb, and you're feeling for freedom of movement relative to the neighbors around it. For this one, I think pulling is terrible, so I would definitely go to the other side to do the opposite lateral bend. Let's pretend I did. Okay, so now we found that. You can use that as your sole palpation method if you want to. I tend to not, so I would then have her lay down face down. So flip a Yui face down. And you can do an entire palpation this direction as well. You can start at the pelvis, and first I like to see if the sacrum is rotated. So if you go to the PSIs on top, and then just come to your dip, and you'll run into the sacral base, the top of the sacral base, and pull down till your fingers lock onto it. And you can see if your fingers are askew. If they are, then you've got a rotation on the sacrum. Then I'll shear each direction on the ilium as it contacts the sacrum, so we can shear off that direction and the one toward me. It's important for this to have your chest directly over top of the patient, because if I'm skewed off this way where my arms are different lengths against the body, it's going to feel like this one where I've got this short lever is always going to be stiffer. So you want to be straight over top so you can really tell what you're feeling. Another fluid motion you can do with the SI joint is coming off here. You're shearing again at another angle, 30 to 45 degree angle. Hit the top of the PSIs, so you're on the superior medial aspect of PSIs. Grab it with hypothenar, and you're going to try and shoot it off at that angle, and look at the feet. In this case, I'm on her right PSIs, and as I shear, the foot should independently move. If it doesn't, if her left foot goes with it, so you see that happen, you've got an SI joint that is restricted. If this ilium is stuck to the sacrum, as I push, it's going to take the sacrum with it and push the other ilium with it. So you'll see that leg moved as well. If this SI joint is free, the leg will move independently, and you won't have the opposite leg going. So with this one, it is way easier to do in a cross-body shear. You can come across and do this. Until you get really good at your palpation, you're actually just going to be terrible at doing that. So just switch side of the table and do it on the other side. Now to the lumbars. You can start with a general extension. You can do it regional too if you wanted to. Just run through and say, oh, this section here is pretty stiff. I'm going to come back to that. Come through here, a little stiff section there too. Then you can come back for individual palpation of the region you felt was stiff. So right here, there. So now I did a little shorter increment extension palpation where I'm going one vertebra to the next. So there's my spot. Check rotation on that. So we got rotation, spinous is kicked off to the left. So what does that equal? The spinous is kicked off to the left. That means the body's kicked off to the right. We're in right rotation, left rotation restriction. Just check rotations on the rest of those vertebrae too. Okay, not too bad. As we come through here, another stiff section right there. And that's got the same rotation. So pushing on the left side of the spinous process from lateral to medial, I'm feeling a restriction there, and 2 up. So that's T4. We're at right rotation restriction. Not much CT action. Maybe that one. It's a T1. Okay, so cervicals, you can still palpate cervicals face down as well. You can hit the posterior aspect of articular pillars and drive them forward. So I'm on the right pillar, which is inducing left rotation. And you can just alternate between index, thumb, and then you can evaluate right versus left as you go. You're just climbing a vertebra. Whoa, I like this right there. We're going to hit that. You're going to climb one vertebra at a time. And that's that. If you want to flip over for me. The other palpation for cervicals. I'll rest my forearms on my thighs or my wrists on the headpiece and do a bilateral extension. I start down at T1 or 2 and work my way up. If you feel an asymmetrical extension this way, it's probably pretty significant. So now we're going to kick her off to a 30 to 45 degree angle and hit the right articular pillars into extension. I use the border of my index finger, and I vary between, that distal joint to somewhere around the middle joint, depending on if I'm low or high on the spine. And we're shearing in the disc plane line, finding restrictions as we go. Oh yeah. Okay, so that's extension, lateral bend. You're coming in laterally. I leave the head on the table. The more you can leave the head on the table, the more stable the patient feels, and so they don't tense their muscles nearly as much, if at all. The lateral bends can be uncomfortable if you pin musculature between your contact and their spine. So as you're palpating, you might find you need to tissue pull A to P or P to A to kind of get that out of the way so you can then feel the vertebra without them wincing due to muscular pain. Then with rotation, head just hanging out in my hand, I'm going to tissue pull into the posterior aspect of articular pillar, hook onto the pillar, and then pull into rotation with individual segments. And that's how I'm going to climb up the spine. Same thing, opposite direction. Tissue pull P to A. So you're going to wrapping around with that tissue pull until you land on the articular pillar. Pull. Okay. Sometimes I'll even grab from pelvis here, see how the shear feels. Again, straight over top of pelvis, hit ASISs, and shear left to right. Hers feel very balanced. A lot of times you'll be able to feel imbalances pretty well there as well. That's what I got for you. Spinal Palpation 101.